Hey future nurses, welcome to the Blueprint Nursing YouTube channel. My name's Nicole and today we're talking about hip fractures. This is a common injury for our older clients and it's a crucial topic for nursing students, especially if you're interested in orthopedics. So let's get into it. A hip fracture is a break in the upper third of the femur near the hip joint. There are three main types of hip fractures. They are classified as intracapsular, also known as femoral neck, occurs within the joint capsule. Intertrochanteric, this occurs between the neck and the lesser trochanter, and subtrochanteric, this occurs below the lesser trochanter. The latter two types of hip fractures are also known as extracapsular fractures. So what causes hip fractures? Well, the biggest risk factor is osteoporosis. Why? Because this condition weakens the hip, causing it to break and possibly lead to a fall. And sometimes falls will cause the fracture, and these are called fragility fractures. Other risk factors include trauma from motor vehicle accidents or sports, certain medications, proton pump inhibitors or central nervous system depressants, for example, and balance issues. Essentially, we're looking at those with weakened bones or risky activities. Let's talk about how to recognize signs and symptoms of hip fracture. Clients with a hip fracture may present with sudden onset of pain in the hip or groin, inability or decreased ability to bear weight in the affected leg. The affected leg may be shortened and externally rotated, and there may be vague symptoms like dull aches, bruising, or swelling around the hip area. Diagnosing hip fracture includes physical examination by a provider and imaging studies with X-ray or MRI. Hip fractures are generally treated surgically by an open reduction internal fixation procedure, or an ORIF, in which metal screws or plates hold the hip together, or total arthroplasty or hemiarthroplasty, which are total or partial hip replacements where parts of the hip are replaced with prosthetics. As a nurse, we will provide care depending on where we meet the client, so the emergency department, pre-op, OR, post-op, or rehab. However, some interventions will be common for some or all of the client's healing process. These include pain management, assessing pain regularly and treating per provider orders, implementing mobility and safety measures, providing assistance with ambulation, providing ambulatory aids, implementing fall precautions. Post-op care, assess vital signs, incision site, and pain frequently, implement measures to prevent blood clots, and encourage early ambulation. I know, that part seems mean, but evidence-based practice supports early ambulation with adequate pain control. And education. Teach the client and family about postoperative care, hip precautions, physical therapy, and lifestyle changes to prevent future fractures or falls. Let's quickly talk more about hip precautions. After surgery, clients should avoid bending greater than 90 degrees at the hip, internally rotating their leg, and crossing their legs. This is really important to prevent hip dislocation after surgery. If you suspect the hip joint isn't in the right place, you need to notify the provider immediately. They should also bear weight according to their physical therapy regimen. What are the complications of hip fractures? Well, a client with hip fractures will likely be fairly immobile, right? So, we'll be looking for complications related to immobility. These would be blood clots, pressure injuries, urinary tract infections, non-union, where the hip does not heal properly, and pneumonia. To prevent these complications, we'll want to be sure to reposition the client, maintain good hygiene, assist toileting needs, and practice deep breathing exercises. Speaking of prevention measures, we can encourage prevention of hip fractures by focusing on fall prevention at home, practicing weight-bearing exercises like walking or stair climbing, and screening for or treating osteoporosis. To top it all off, we have a short memory tool to recognize symptoms of hip fracture. SIP, shortened or externally rotated leg, inability to bear weight, and pain at the hip. Now you'll be able to recognize and assist clients with hip fractures. Here are the materials we used to make this review. Thanks for watching, everyone. Of course, you can catch us on all social media platforms. If you have any ideas of what topics you want us to cover, leave a comment. We've got lots of other topics for you to watch and many other options to suit your personal study needs on our Blueprint Nursing website. Keep up the great work and we'll see you in the next video.